we've just talked about the coil. The commonest medications that will come to mind when we're thinking about heavy menstrual bleeding are things like your pill, the progesterone-only pill, for example, and the depot, that's the depot injection shot. For some women, now not in all cases, some women do not experience side effects. We're all different, but I wouldn't be surprised if somebody came and said that they started the mini pill and then they're experiencing heavy bleeding, or for example, starting with the depot. A lot of the time, these side effects do settle down. Okay, they do settle down after a few weeks or months. And that's why we doctors, when we start you on these conditions, we say if the bleeding is not too troublesome, give it a few months, give it about 6 weeks to 12 weeks for the levels, your hormone levels to calm down. Give it some time to settle before you say that, well, this is just, I can't cope with this. Unless it's just ridiculously abnormal from the get-go, in which case, please speak to your doctor. We don't have energy. We're not primed for suffering. So really, you should speak up if you're struggling with it. When you first start having your periods, so this is known as a menarche, as a young lady or young girl just going through puberty and she starts her periods. Within the first 12 months, she might have irregular cycles or irregular periods when at some point her ovary releases an egg and then she has a menstrual bleed. The next month, it might not do so, and then the following month there's a big collection of bleeding that comes out because she missed a cycle the month before. This pattern of irregular bleeding, which can be heavy at some point, or there might not be anything for a few weeks, this type of bleeding is because the menarche, it's just starting. The periods are just starting. It's going to take some time for the hormones to come to a balance. So the response of her ovary to the hormones coming from her brain, directing the hormones in her reproductive tract, they're still going up and down, they're still fluctuating. With time, they will come to a nice level pattern, and then she would have her regular monthly periods for most of us. But for that first 12 months, some girls, not all girls, some girls may have 1 month where there's a bleed, the next month nothing happens, then the month after there's a very heavy bleed, and then an irregular pattern. And after some time, usually about 12 months, it does settle down. Okay, so we say those are a cycle that can happen in a young girl who's just starting her period, which is menarche. I think we're at number 13. I hope you're keeping count. But anyway, we have already gone past my 10 fingers. I just wanted to prove to you that when you hear heavy menstrual bleeding, please don't just think of hormonal imbalance. And number 13 is the one that doctors, after we've done all the tests and we haven't found anything. It's not fibroids, it's not endometriosis, it's not cancer, it's not pill, it's not coil. So we haven't found anything. It's not polyp. We haven't found anything. And then it's a term that we use for this condition. It's known as dysfunctional uterine bleeding. So there hasn't been any abnormality detected, even when you have your scans and they measure the width of the womb, or they do the hysteroscope and they look, and then they get tissue cells from the womb to look under the microscope, nothing is found. We refer to it as dysfunctional uterine bleeding. And the suggestion from studies is that it may be because of some chemicals. There's a special chemical known as prostaglandin